Are you live? Hello, Facebook community. Welcome to Face2Face Therapy Podcast. Once again, it's Mental Health Awareness Month, and we are doing something new, a little out of our comfort zone, as I've said before. So we're doing the Facebook Live, the podcasting, to talk about mental health and bring awareness to Mental Health Awareness Month.
Show some of the big guests that we've had.
Yes,
we've got some huge guests for mental health awareness.
We were talking about this actually, someone else, and you were like right in there. We've had somebody said you've had some really big deal podcast people, and I was like, yes. And we're having our other really big deal. You're in our top 3 for big deals.
Oh, you're very flattering. Thank you.
So we've got Matt Troup with us he's the CEO of Conway Regional Medical System now? Is that or we
Health system generally,
system.
but yes. Most of us in Conway know it is Conway Regional Medical Center, but we are more than just a hospital. We have physicians that are part of our organization, also a smaller hospital up in Dardanelle that we manage.
I didn't know that.
And other things within the health system. So it's we try to refer to it as health system, but just call me Matt. Yeah.
Well, we're really glad that you were able to make time for us today. I've seen a lot of you in the media lately about leadership and your leadership style and winning some cool awards yesterday. Would you tell us a little bit about that?
Sure. So back several years ago, I was part of an organization actually in Dallas that was recognized by Modern Healthcare. So I don't know if in the counseling world, I doubt it actually, you read much of Modern Healthcare, but they're sort of what I would put the equivalency to as a Wall Street Journal of healthcare administration.
Okay.
So it's a weekly publication, and it's generally what we in the administrative world read just to stay caught up to what's going on in our industry. Well, many years ago, they came out with a best place to work survey process. So they sent out a survey. You complete this application that talks about the benefits you provide and explains your culture and what you're all about. And I was part of an organization several years ago that won, and I just thought it was really, really cool. And it's been a lifelong goal of mine to actually be a CEO of a company that won. At the time, I was an administrator. In the first year, we applied, which I think would have been, this is our 3rd year in a row for Modern Healthcare. I think it would have been about 4 years ago. We applied and we didn't get it, and I just expected that, and that was okay. It's a process. But 3 years ago we were recognized, and then again last year, and just found out actually just last week that we'll be recognized again the 3rd consecutive year as the best place to work with Modern Healthcare. And so
that's awesome.
I think it really speaks to our culture. As in a lot of things, it's not about the award. The bling is nice, and it's great to get the recognition. But I think it's more of a validation of our culture and where we're headed. You get a lot of great feedback through that survey process. Even though we're a best place to work, we always have things to work on, always have things that we try to be attentive to. And that survey is really a good tool to give us that. So multiple reasons to do it, but I'm very proud of that.
I've had the fortune and misfortune of having a loved one in your facility for one reason or another for the past 3 years. And I know when I had a family member get sick, it wasn't even a question. Obviously we're staying here in town. That's, we're going to Conway Regional. There was a time that was a question that people asked, do I want to go to Little Rock or do I want to stay? And we didn't hesitate, and I'm so glad that we stayed here in Conway. And then I had a friend that needed to go in 3 days ago, and I said, of course, we'll take you to Conway. And that culture's still there. I mean, it's still the same. You can tell that we made the comment, I'll tell you this, we made the comment that the nurses were dancing around each other like the way a bartenders would, when they just knew each other. They knew each other so well. And someone made the comment, how long have y'all been working together? And someone said, oh, we've been partnered partnered up in the hospital for 4 years.
Yeah.
So that's something to go into an ICU. And, it's a stressful enough situation, but clearly you've got, these capable people that not only capable, but they've been around each other and in that same culture, like you said, for quite some time. So it's obvious when you go in there and you spend more than 5 minutes that there is a different culture at that hospital.
Yeah, well, thank you. We really try to drive that home with our staff that they are one team. We have a tagline: "We're one team with one promise."
Uh-huh.
And in healthcare, and as healthcare providers, you guys can empathize with this. We tend to think in a very expert culture kind of way. So the doctor has their box that they operate in, the nurse has their box, the respiratory therapist has their silo, et cetera, et cetera, et cetera. And we have really tried to enforce both with our language and activities that, hey, we are one, we're all in this together. And so it would be my hope that whether you're in the ER, in the OR, even in administration, you see that same dance go on wherever that is, because it's really, really important. Healthcare is just too complicated to function effectively when we're all in silos. So
I read something on your LinkedIn page that was something to the effect of you specialize in transitional leadership. What is it that, and forgive me if I put words in your mouth, what would you consider yourself in a transitional role at this time, or would you consider yourself more as a
the word, I think, and it's been a while since I've updated my LinkedIn page, but I think the word you're looking for there is transformational.
Yes.
And to me, that term means that I just don't look at each either business relationship or relationship with a physician or a staff member in a transactional sense. So in other words, and any business functions this way a lot of times. I have a good or a service, you want to buy it, we negotiate terms and we buy and sell. And a lot of times that's the way healthcare works. I want to have a relationship. I want to have a transformational relationship where we're partners. And while you're a clinician, as a physician, you're both a customer to me because I need you to want to work in my hospital and take care of your patients in my hospital. We're also partners because the care that I provide and that my team helps you makes you more effective and gets your end game. So let's transform the relationship in the equation from one that's just purely transactional. I have nurses in a hospital and, doc, you come work here and I try to make your life easy, to really transformational. How can we take care of that patient that's at the bedside in a way that delivers the best care and the best excellence that we can, and transform our thinking really to more partnership and relational based, because the highest form of power to use that term that I could have isn't my position, it isn't coercion, it isn't threatening people, it isn't in the fancy words I can use, it's in the referent power in relationship. And so that's really what we're trying to transform, and I try to think of myself that way too.
I think that's what makes a good leader. And I'm a bit of a leadership snob because I was in the military for Marine Corps for 9 years, so
wow.
They drill all the different leadership styles. But something that you did, I thought, that showed your leadership style was during the snowstorm. Do you know where I'm going with this?
Yeah.
There was a picture of him out scraping the ice off his employees' cars. And I was like, yes, that's a leader.
Absolutely.
The first time I did that was...
So you did it more than once.
Well, it was the first ice storm in my 5.5 years here, so it would have been probably 4
So
years
don't
ago.
worry, you won't have to do it for another 10 years.
Well, this is where I'm headed. In our world, that means in the administrative world, a lot of our meetings get canceled, things get put off, and so I always have felt like as a leader, if I'm asking a nurse to get up at 5:30, 6 o'clock in the morning to drive on treacherous snow and ice to come take care of patients, I better have my butt up there. I mean, it's something with 4 sons. You can appreciate my sons. Anytime it's snowed anywhere we've ever lived, they've like, oh, this is a great day in the snow with Dad. And nope. I'm going to work. I have to be there. But anyway, so you get there and you're like, well, what do? I've had this big deal to get up here, and started to think, well, how can I serve others in this situation? And you start to think about nurses coming off a 12-hour shift through the night. They're cold, they want to get home, but they got to wait for their stupid windshield to frost. And so I did that the first year, and then of course when this big ice storm came in February, I'm like, well, I set a precedent. Now I have to, I really feel obligated to do it. But no, it was great. And it wasn't just me. There were several other of our team that were also out there in the near 0 degree temps, blowing off and scraping ice. And I think that's the least that we can do. That really is not. That ought to be the focus of every leader is to be other focused. There's a big term, servant leader, right? And there's a whole genre of literature out there about servant leadership.
Yeah.
I ascribe to that, but I think more importantly, that needs to be a redundant term, right? The whole essence of leadership ought to be about how can I make you better? How can I support our team so that our team functions better? That's at the heart of leadership, not just servant leadership. So anytime I can consciously think of, okay, how can I serve others? How can I do, and that snowstorm, it was, well, get your butt out there and scrape some ice. So that's what I did.
I'm going to bring up something. I'm not even sure how to ask this because it's such a complicated situation, but obviously COVID happened, it's happening. And there was lots of different stories in the news, and obvious that our healthcare workers are really struggling during this time. A lot of extra different types of pressures, and definitely mental health suffering, right? You as a leader supervising healthcare workers, did you do or see or anything different with mental health or with your employees during COVID?
We have an outstanding culture. Of course, in my role and in my position, you would expect me to say that. And so, kind of going into COVID, I think I kind of wore that, we have great people, we have a great culture, we have a great sense of family. And even then I still had to catch myself to say, but we need to be attentive. We can't just ignore that. Or just rest on our laurels administratively and say, well, they're good people, they got a great attitude.
They'll get through it.
They'll get through it.
Yeah. Rub some grass on it.
That's exactly right. And I, frankly, would be in a healthy way, surprised sometimes by the raw emotion of nurses coming off a shift, seeing them in tears, and seeing the way that they would react, and just the physical exhaustion that would go on. And so we tried to be very deliberate to do the things that we knew that we could do. And so there were some things, and we don't, these aren't things that we put in the media or that we talk about, publicly very much, but here you go, Facebook. The mask that nurses, particularly on the COVID unit, would wear would really wear down their skin. I don't know if you guys read or heard a lot about this, but they fit so tightly, and you're breathing in and out of that. You got forced air, and so we gave our COVID staff a facial. Not me personally, but it was a spa actually on our campus, and so we bought a bunch of facials. So they got facials,
I love that.
And to a workforce that's predominantly female, that was very much appreciated.
Yeah.
We realized that we were asking our people to work a lot extra, and sometimes they just didn't have time. So we worked with a local landscape lawn company, and we mowed yards for staff who dealt with COVID.
Awesome.
So did two lawn mows associated with that. We gave away a lot of food. So from the time COVID came on, really up until through January, you could eat free, breakfast, lunch, dinner. You're an employee.
You're basically like a social worker. I just want you to know.
Well, one of the things that we were trying to make life easy.
Yeah.
And so if you think about the role of a nurse, a mom or a dad is coming into work, and you got all this stress of going into this environment. Can I at least take something off your list so that you're not having to think about what am I going to pack for lunch?
Right. Yeah.
We opened up a daycare from spring break all the way through the end of school last year. So about this time, opened it up at our fitness center. So you got kids, hey, your daycare is shutting down and you don't feel comfortable with the hygiene of your daycare, we'll take them at our fitness center. We had take-home meals that were greatly discounted. So you're a mom, you're stressed, you've got to get home and feed your family of 4, go by the cafeteria, we've got a pre-made meal for you. It was really, really cheap. You take that home, check that box. And so we constantly try to think about how can we think about things that we can do to make life easier for people, and so that at least that was fewer things that they could mark off their list.
Yeah, because they had so many extra sort of things to focus on at work. You freed up some what I call psychological space for them.
Yeah,
they didn't have to worry about dinner or the yard. They could focus on those extra things that they have to do at work.
Yeah, and there are things that are remarkably cheap. It costs a little bit of money, don't get me wrong, but on the grand scale of things, when you think about the size of our organization and what we spend on salaries and wages, overall, to provide a facial for someone is small potatoes in the scheme of things. The other thing that I think that we really tried to do, and this comes through how we communicate, what we communicate, how we encourage staff, is really reminding them of why they're there. To quote Esther, the book of Esther in the Bible, Esther really saved the Jewish nation, and it was her cousin who told her, and she was the queen of these bad guys who were waiting to wipe out the Jews. It was her job to convince him not to, and her cousin tells her, this is the moment for which you were made, in Esther 4:14. And we really tried to talk to our staff about that. Where else would you rather be? This is the moment in which you were made. Is this moment right here and right now? And everything that we did tried to reinforce that message, because it's hard.
Powerful and inspiring.
As hard as it is, I can't make their job easier. I can't make the gowns that they wear any lighter. I can't make that mask any better. I can't eradicate COVID.
How do you bring comfort to those who bring comfort? I mean, that's a serious question.
Yeah, it really is, and like I was saying before, it's sometimes it's surprising to me, but in a good way, just to see how real that is. There was a news story, and I forget what channel it was, Fox News maybe, out of Little Rock, came up and did a news story about nursing in COVID.
Oh yeah, I remember that.
And they interviewed some of our staff, and some of our staff really broke down. I mean, really had a difficult time just communicating what it was like to be in a patient's room who's potentially dying, going through this difficult thing, don't have any family in the room. Remember, they can't have visitors. But the message I shared with them, and the message I shared with media and with our team, is that just shows you can look at that situation and say, that's so impossible, how difficult, that poor nurse. Or you can say, that's someone who deeply cares about what they do and the people they care for, and that is a really good thing. And that is that is something that we need to comfort and put our arm around that person and let them know that we support them, that we love them, and so much appreciate the compassion that they have. The last thing you want any nurse to do is to go through that and walk out and like it's nothing.
Yeah.
Well, you seem to be, pretty keenly in tune with the needs of folks. Does that mean that you're more likely to take care of yourself or more likely to neglect yourself?
Just on my own stuff. It's funny. I think people struggle with that. Obviously, I have a pretty structured routine for my life. I get up in the morning. I typically will read, whether it's leadership oriented or scripture or religious based. I have a daily habit of most days running, of doing some form of exercise as a physical release. And relationships are important to me, and So managing and nurturing my relationships with my team are another way in which I can decompress and manage the stress of it. So I always think about balance, and I'm sure
the B word. We call it the B word
yeah.
around here because it is
Mythical.
It is mythical. Yes. I don't have it. I don't claim to have it.
You're ever going to walk into your office one day and go, this is what balance looks like.
Right.
I've done it. Not going to happen.
So, I don't, the end isn't balance. The end is to know that I'm making a meaningful and significant impact on the people I work with and the people I serve. And man, if I can have that, if I can walk home at the end of the day and feel like I've made people connect meaning and purpose to their work, that they are happy and they feel fulfilled in their role, that I feel fulfilled and happy in my role, and I feel like I'm making a difference. And the long hours and the stress of it don't seem to impact me as much. Having a remarkably organized and on top of it wife helps incredibly.
Yes.
She has been an incredible support to not just to me but to our household. So a lot of the stresses that people face with getting kids back and forth to events and practices, I don't have as much because I've got a partner in every sense. So.
Yeah, you don't know his wife, but I do, and she is amazing and very professional, and I seek counsel from her myself. And when the therapist seeks counsel from you, you've got it going on. And you are known to sort of walk that walk, because I have heard people say, I saw Matt Troup running on Tucker Trail or whatever. Yeah. Somebody told me that.
Not very fast.
Somebody told me that like a week ago. I said, I saw him running on the trail. It
is incredibly therapeutic for me. I don't practice meditation, but when I run, when I hear people describe meditation, what it's like to meditate,
it's very much the same.
That's what I do when I run. I feel like my brain can just kind of not necessarily wander, but it can think about things, and I think I come up with some great ideas. Sometimes the staff hates it when I go on a run because I come back and I'm like, hey, we should do this.
Oh yeah, you're all motivated.
Yeah.
Oh no,
Me
he's
too.
back from his run and he has a list.
Right. It's 6 o'clock in the morning. So yeah.
One thing I do know about your organization that is good is you guys do offer what we call EAP, Employee Assistance Program, where you pay for your employees to get free therapy, basically, many sessions. And I have the privilege of one of my colleagues, Sharon. She is one of those therapists.
Oh.
So she gets to provide that service sometimes.
Yeah.
And that is any business should really consider that, because that means that they can go to therapy. It costs them nothing, no copay, nothing against their deductible. We can talk about that another time, but that is something that you guys offer that is impressive.
It really is, and it's we get compliments from our EAP provider on how much EAP gets used from our staff, which and when you first hear that, you get concerned, like, what do you mean they're using it a lot? Is there something going on that is causing that? But then again, it just shows that it's valued and it's needed, and that they're reaching out, which you obviously want them to do. But yeah, that's just been a wonderful service. One of the things that we did over the summer, COVID feels like it was some sense 2 years ago, and then it's still going on, but we brought them in to talk to about our top 110, 120 leaders about how to manage stress. How should they practice self-care? How do they respond when their staff is burned out?
Right.
So as a leadership team, we listened and learned about those same techniques, and having an EAP provider be able to do that was a huge resource for us. Because as you were saying before about rubbing dirt in it, in healthcare we tend to have that mentality, like, hey, this is just tough it up, suck it up, let's go. But you can't,
I think that EAP is so helpful, and because I have, I don't work with your EAP, but I do lots of other ones in Arkansas. And I'll say the average person that comes for it's like stress management, or
Yeah.
they want to learn. It doesn't mean if you're using EAP that you're falling apart and there's a crisis. It could be that you want to learn some new skills to communicate better at work or with your partner, or decompress when you get home. It doesn't have to be a crisis.
Or even, family issues.
Totally, yes. Parenting.
So
Yeah.
I'm embarrassed to say this. So I work for Catholic Health Initiatives at St. Vincent in Little Rock. So I don't have the same EAP. I'm pretty sure they have an EAP provider. But
Yeah.
We went through this past year some difficult placement challenges with my parents. They're getting older. They need to live in assisted living. But the point I'm making, EAP is even a great resource for that to help.
Yeah.
You need to get an attorney. How
Yes.
what are the next steps? How do you help
Right.
Your loved one get through that? So what a great resource to have.
It's a great resource, yeah.
And all these things are great altruistic things to do.
Mm-hmm.
But they also happen to be really good business. I think
Conveniently.
I marvel sometimes at people who get, we can't do EAP, that's too expensive, or the meal thing I was talking about, we can't do that, that's way too expensive. Well, what's the cost of people getting burned out and leaving?
I would agree. Even for little businesses like me, I'm surprised at how much just buying lunch,
Can do.
really means a lot. And like you said, it is good business. It's tax write-off. It's, there's lots of positive things about it.
Lives out your values, so people feel like, hey, wow, that organization really,
yes,
organization's values and my values align. And so this better connection.
That's awesome. Well, Bradley, did you have anything
I think
else
that's it. This was really, really great.
Yeah, we really just wanted you to talk about the things you just talked about. It's so nice to meet you and to talk about leadership. Do you have any questions for us?
Oh gosh.
Now I really put you on the spot.
You did. You did. No, I don't think so.
Yeah.
From a counseling perspective, what's your interface with primary care in the community, and how?
I actually coordinate a lot with doctors in town. We do referrals back and forth, I would say daily.
Yeah.
I tend to have some of my favorites because I'm pretty picky. I work a lot with the guys at Bannister and Levelong, which I think they are somehow even connected to you or something.
We have a great relationship.
You have a good relationship with them.
No formal business.
Yeah. Well, I mean, they're usually the ones that end up sending me to Conway Regional. Which you have a new psych floor, right?
Yes. Adult
only, and then starting outpatient, I think too. Maybe?
Yes, we have a advanced practice nurse who will see new patients. Works also with Dr. Annette Anderson, who does geropsych outpatient as well.
So we work with her too, because Sharon and I are one of the few Medicare. We do a lot of Medicare because we can do Medicare. LCSWs can do Medicare, and that's another whole story. LPCs can't, but whatever. So we take Medicare. So we do work with her. I don't. Sharon does. And then, I do quite often have to send people to the ER for crisis situations. And so I've dealt with that.
So one of the reasons we opened a unit, it's a small unit, about 11 beds, is to serve that Medicaid population, who there's a limited number of Medicaid behavioral health beds in the state.
Yes.
And so what we find is that that's a good option rather than having to send patients down to Little Rock. We were sending approximately one patient a day, so about 360 patients a year were getting shipped in an ambulance down to Little Rock for care, oftentimes after 10, 12 plus hour delays in the emergency room.
Oh yeah, which I have a good relationship with Conway Behavioral Health, but they can't take Medicaid because this is just some education. You probably know this already.
Some inside baseball.
You have to have be attached to a hospital.
Acute care hospital.
Thank you, to be able to take Medicaid mental health patients. Like Conway Behavioral, for example, they're on their own.
Right.
They're not separated, but like your Baptist and St. Vincent, those. But
And a
and
lot of-
I've had patients who've been in that unit, your
Yeah.
unit before,
Yeah.
and they speak super highly of it.
Good.
I will say that.
Good. We've got a great partnership with Unity out of Searcy. So they have a
okay.
psychiatry residency program.
I didn't know
so
that. Okay. I mean, I know Unity, but I didn't know that you were working with them.
they help manage the program. So the
Mhm.
leader for that unit, even though the employees are Conway Regional,
Mm-hmm.
the manager for that, the director for that unit, we access through Unity, and then the physician oversight for that unit, as well as for inpatients that happen to get admitted there.
And I kind of forget how big you all are, because to tell you the truth, mostly what I do is for any type of mental health disorder, it's usually therapy and medication. I don't do the medication, but most of the medication that I'm working with for depression and anxiety is done through the PCP, not
Yeah.
necessarily the psychiatrist. So almost all those people see PCPs from your clinics,
Yeah.
right?
Yeah.
And I look at you and I think the hospital, but
Yeah.
you guys have actually been opening up clinics all over, right?
We have, yes, lots of primary care clinics, out
Yeah.
in Clinton,
Yeah.
Russellville, Dardanelle, Mayflower, Greenbrier, Brandon and Greenbrier.
And even are these like the one at Hendricks?
Yes, at Hendricks, Conway Med Group, which is
Okay.
on Prince Street. Not on Prince Street, it's on College.
Okay.
Prince Street Clinic is another clinic.
Okay.
So that's been with those APRNs. They
Mhm.
can help, if there's a medication issue or question, help
Right.
manage that. And then we've started to have some counseling within the clinics as
Mhm.
well. Just that the more that can be integrated, and to your point, with primary care oversight,
Yeah.
the better.
And I'm all for that. And most people in Conway that are in mental health, we want more good mental health.
Right.
Because all of us, like we were talking about this before, most of us all have a wait list, literally, because there's just so much need for it.
Annually, we will poll our medical staff and ask
Yeah.
about services,
Mm-hmm.
physician or otherwise, that
Mhm.
are needed in the community. I mean,
Yeah.
should have mentioned before, I'm sure everybody knows we are a community-owned nonprofit, so we should be about serving the community need. That's part of it.
Right. Well, I didn't realize that you all were a nonprofit.
Yeah,
Yeah.
I'm glad I said that then.
Yeah. Yeah.
But psychiatry and mental health services is
Uh-huh.
consistently in the top,
Need.
2 to 3, if
Mhm.
not 1 some years. So it's a huge need,
Mhm.
and you see that out in the community all the time. And so one other question for you: telehealth,
Mm-hmm.
has that been an effective tool for you? That's something in the pandemic that certainly we've.
It has been a very effective tool. This is just me as a clinician. Mask was very difficult for me
Oh, I bet.
because I couldn't see the expressions. They couldn't see my expressions. And so at that point with COVID, I actually would prefer the telehealth versus sitting in a room with masks on, to be honest.
Yeah.
But I just have always gone with whatever my patients need.
Uh-huh.
So I'll do whatever they need. If they want to come in with a mask on and me to have a mask on, I'll do that.
Yeah.
There was some time when I guess there was more COVID cases where I would have whole days all I did was telehealth because that's what my people wanted.
Yeah.
Now it's getting less and less that more people want to come in.
Yeah. I heard one psychiatrist speak, I think it was actually on a podcast, I can't remember which one, about telehealth. And she said that the difference, what she gleaned out of it was she got to peer into some of her patients' homes and see, are they,
What things look like.
what's it look like? Is this chaotic environment?
Right, yeah.
Or is it neat and orderly?
Mm-hmm.
She also had another perspective that in some of her patients, clearly COVID had a detrimental impact on their mental health.
Yes. My
has
clientele has more than doubled
Oh wow!
since COVID
Wow.
happened. Yeah.
So you're going to answer the next part of the question.
Yeah.
So there was another part of her
Yeah.
population, the patients that she cared for, that actually got better. That they
Mhm.
found that when they got out of their caustic work environment, or maybe they got to spend more time at home with their family, that things actually improved.
I keep hearing this
Okay.
from just like a handful of people, but I don't really see that from my people. Now, some of my people who want to be isolated and not have relationships with other people, they're like, yes,
This is great.
I'm not going to the grocery store for 2 months.
Yeah.
But me as their therapist is like, I don't know if that's good for you.
Right.
You know what I mean?
Yeah.
And I've had some of them now where this has been a year.
Yeah.
And now they're having trouble getting back out into society.
Interesting. Very interesting.
Yeah.
We have, in our own work environment, you know, we've been doing everything over Zoom or Teams. I got the giggles the other day. It was a few weeks ago now. I get out of my office during a meeting to go to the bathroom and down the hall, and we were all, the whole suite was in the same meeting. You could hear the echo of the meeting so it's just like, she's just right there, but she's, you know, staring in the Zoom. It's just really bizarre. But we have been much more intentional with, hey, this is an in-person meeting, you know, and starting to pull back more and more. Yeah, I don't want you staring at a screen anymore. I want to see your face, you know. That we're not to that point of mandating it yet, but it's hard to build culture and truly interact with people if you can't.
Yeah, that's my only, I'll say, concern about the telehealth is because some people keep asking me, like, can we keep doing telehealth? Like, can I keep doing this? And I'll say, it depends on if your insurance is going to keep paying for this.
Well, you're right, and how long that happens, yeah.
Because for us, at our level, a lot of, for that period, that's say 6 months, no co-pays for telehealth. So then everybody was doing telehealth.
Yeah.
But then when they have started taking definitely that away, and some insurance companies are telling us like that they won't cover telehealth now. So I don't know how the future looks for that, but that'll change. Something to lobby for. Yes, that's why I know a lobbyist.
I think they have settled on initial visits got to be in person, but then follow-ups can be more telehealth. Is that generally?
Yes, that was the way that we got the law amended, was that they wanted the initial visit to take place on video. However, this session that was waived, and now it's audio. We were the only state in the union that was still video in-person encounter. So we're now audio is allowed. So,
well, I think telehealth. I think 10 years from now, as we look back on COVID, COVID will really be one of the things that we'll be known for, or most remembered as, is the era of telehealth. I think it's here to stay. I certainly hope that it's also in the right context. You know, some things it just doesn't work well, and you got to see that person. But I think that's a good that could hopefully come out of this.
I think it's positive. I mean, because definitely some people it works for, especially, you know, people that are used to working in the IT field or working from home anyway. It's super comfortable and natural for them to do telehealth.
Yeah, right. And particularly now, you know, for the last year, if you've worked at all, you've done most of your work over a screen, and so it doesn't feel as uncomfortable talking to a therapist or a doctor over the screen either.
And I've heard from some of them that they feel like that they can open up more over the phone or telehealth.
makes sense.
Yeah. It does make sense. So that's good stuff.
Awesome.
Yeah.
Well, thank you for joining us for Mental Health Awareness. Thanks, Bradley, as always, for helping me. Thank you, Facebook followers. Make sure to check us out. We're also going to load this on all of our regular podcasts, Apple, Spotify, all those fun things. We're everywhere. Don't forget to check us out on that and subscribe. Just see a button.
Push all the buttons.
And my girl Tess is not here to stop this video, so Angela's going to try it. She said, push it and slide. There we go.
I did.
They work.
I did it.
Cool.
That's blinking.